Okay, perfect. So on Monday, what we did was to go through a few things about healthy eating. We defined what healthy eating was, and we discussed a few steps to help people eat healthily. Why is it important to eat healthily? We went through a few things that, for us as Africans, makes it even more important for us to be eating healthily. One of which was the fact that our risk of developing certain conditions, such as blood pressure, type 2 diabetes, and also dying from COVID when we do have the infection is higher compared to people from other backgrounds. So for that matter, we need to eat healthily in order to protect ourselves. And we also went through a few pointers as to how to eat healthily. We discussed what is peculiar about the traditional African diet and what has changed over time, such that we will know how to get ourselves back to what the traditional African diet was, because we discussed that the traditional African diet was very healthy, but it has been over the time modernized into a Western diet, which is what is making it difficult for us to maintain a good health. And we went through very specific um, um, tips, such as being clever with your carbs, i.e., choosing the right type of carb because the carbohydrates are not the same, choosing ones that are whole grains, choosing ones that are based on fruits and vegetables, but also being mindful of our portions, because if we are able to eat less than we used to, then we'll be able to save some calories, which would then help us to lose weight if we are trying to lose weight. We also went through a few things such as drinking calories, and we mentioned that it is not good for people who have teeth to be drinking calories, because the way our body functions is such that we don't recognize calories from drinks the way we do from food. And then we also talked about reducing. Sorry, we talked about reducing salt, because eating too much salt can affect our blood pressure. So today, what we want to do is to go through snacks, how to choose right snacks, and also go through things like how we can eat to improve our immune system, especially, which is important, especially nowadays with the COVID pandemic. And then towards the end, I will take you through some practical ways to be able to more or less safeguard any changes, any dietary changes that you make, so that you can be able to sustain it for longer. And the reason for that is when you make dietary changes, the benefits that you accrue usually is long term, i.e., when you make changes now, it is unlikely that you see most of the benefits now. It's only when you sustain it for a long term that you benefit more. So my first discussion today will be how to plan your snacks. Most, or I'll say some healthcare professionals believe that people should not be eating snacks. But my view is that, and many people agree with us, that snacks should be part of a healthy eating plan. And the reason is that there are specific foods that traditionally many people eat it as snacks rather than eating it as their main meal. So if they do not have snacks, it's very unlikely that they will have those foods. And I'll take you through some of those key foods and key nutrients that we usually get from snacks. The difficulty is, over the years, in the 80s, we used to have about just about 20% maximum percent of our calories coming from snacks. But now you can have people who have as much as about 50% of their calories coming from snacks. And because most of the snacks that people choose are not as healthy, that is where the problem comes from, because then you are adding more calories which will then increase your weight, but also you are adding, most snacks are processed. So you are adding more processed foods to your diet, which is not helpful from the standpoint of your risk for diabetes, but also your risk for high blood pressure and things like strokes. So it is important. The key question is, yes, snacks are important. You need to include some snacks, but you have to plan for it. Planning for it means that snacks should replace some amount of food you're eating. It should not be on top of your usual foods that you eat. And then planning also means that you buy the right kind of snacks. What do I mean by the right kind of snacks? Usually, these are the type of snacks that people eat. Your crisp, it is full of salt. Some of them are less salty, but then it is still a lot of salt in there. It is also fried, so you are introducing some amount of oil, which usually would have been used over and over, which is not good for your cholesterol. And then even for those that are baked, you are also having potatoes which are chipped and which are processed in a high temperature. And we know that things like chips from potatoes are linked to higher risk of type 2 diabetes. And then you have things like cakes, you have things like biscuits, which have saturated fat in it. And we know that saturated fat, many types of saturated fat will increase your risk of cardiovascular diseases because they increase your cholesterol. And then there are other snacks that are also based on purely on free sugars. And we know that free sugars not only add to your weight, but also can increase your risk of type 2 diabetes. So what are the best snacks to choose? I'm sure this will not come as any surprise, or many will not come as any surprise, but the best snacks usually are your fruits and vegetables, mainly because these are not processed. These are foods that are usually lower in calories, lower in salt, so they are generally very good for you. Some people might be a bit concerned about sugar in fruits, but the evidence is that sugar in fruits, whole fruits, are not a concern, but sugar in things like fruit juices should be a concern. The reason is that when the sugar has come out of the plant cell, then your body does not process it as effectively as it's supposed to. But when it comes with the plant, i.e. when you eat the actual fruit, because of the fiber, then your body gets the goodness out of it. Then there are things like your nuts, all kinds of nuts. Some people might be concerned that nuts contain fat, but most nuts, the fat in nuts are unsaturated fats, and those unsaturated fats are good in protecting your heart, unlike saturated fat. And then things like your yogurt, dairy, fats from dairy are not associated with heart diseases, so you can have dairy as well. So things like your yogurt, your best bet will be yogurts that are not or yogurts that do not contain extra sugar. So your best bet will be the natural yogurts. They are very good. And then you can also have some raisins and some dry fruits. The only thing is that when you're having dry fruits, limit the amounts because they could be a bit more concentrated. Then because I've also already mentioned fats, we need to understand the different types of fat. Fats on its own are not different when it comes to calories. All fats contribute the same amount of calories. The difference is how they affect your cholesterol. The difference is how they affect your risk of heart diseases. So we know that usually fats from plant sources are good in protecting our heart, whereas most fat from animal sources are not as good. So I'll explain to you how to identify good fats and how to identify the fats that are not as healthy. So fats usually from plant sources, as I mentioned, from seeds, from your nuts are good sources of fat. Also, fats from things like your olive oil, vegetable oil are good. On the other hand, fats from red meat, fats from processed meat, and also even fats from our palm oil are not as good because they contribute saturated fat, which will increase your risk of cardiovascular diseases. Also, many of you may hear some marketing gimmick around coconut oil. Compared to vegetable oil, such as olive oil or rapeseed oil, coconut oil is not healthier. But compared to things like your palm oil, then coconut oil is healthier than your palm oil. So you have to understand what you are replacing your coconut oil, or what your coconut oil will be replacing. If you replace palm oil with coconut oil, then you are doing better in terms of your health. But if you replace vegetable oil with coconut oil, then you are not doing yourself any good. So my advice would be have at least one portion of oily fish a day or a week. Oily fish comes from things like your mackerel, your sardines, your pilchard, your herrings. They are good in protecting your heart. One may ask whether you can have the ones that are canned. Yes, you can have the ones that are canned. But if you're going to choose the ones that are canned, be careful not to choose the one that is canned in brine. Brine means salt water. And salt, as I've mentioned earlier, can increase your risk of cardiovascular diseases. So you want or it will increase your blood pressure. So you want to choose canned fish, in other tomatoes, or even oil. And then you might want to drain the oil, or even water, and you might want to drain the water, but not brine. And also I've mentioned that as snacks, you can have some nuts with seeds. You can also have some avocados. Again, somebody might say that avocados are full of fat. Yes, they are full of fat, but they are good fat. And that is the kind of fat that we want people to be having more. And then as I've mentioned, use vegetable oil, i.e. in this country, when they label it as vegetable oil, usually it comes from rapeseed oil, and rapeseed oil is good for you. It is the closest you can have to olive oil, and it's cheaper than olive oil. Then on the other hand, I want you to reduce the amount of red meat you have and also processed meat you have. In this country, the advice is that you don't have more than 70 to 75 grams of processed meat or red meat a day. And that is about the palm of your hand. Or you can say, if you see a packed plain cart, about that size is about 75 grams of meat. And you and I will agree that many of us, when we do have meat, will be more than that. So just be mindful of that. The other thing is that don't reuse oil, especially when you have deep fried. You don't reuse it, because at high temperature, the oil can become rancid, especially when you leave it and then you come and use it again. And that will not be good for your heart. I've also mentioned that palm oil is not it's not the best type of oil. So if you use it sparingly. And then sometimes when we cook, you can see, especially if you cook with meat, you can see the visible fat which comes all up your stew or your soup. Usually, if you let it set, then you can scoop or skim that off. And that will mean you eating less fat, especially eating less saturated fat if it is coming from the meat. The best advice perhaps somebody can give you is to have more vegetables. And the reason is that of all the food groups, vegetables are the ones that usually will have less calories, but also they give us a range of vitamins and minerals that we do not get from any other food groups. So have more vegetables, especially when you're trying to lose weight, because it can fill you up and help you to eat less of other foods, which will mean that you are cutting down on your calories. The key to getting the goodness from vegetables is by having different types of vegetables. And I cannot stress that enough. The reason is that because of the different colors, if you see even this picture that I've shown you, you can see that there are different colors. You can see some vegetables that are purely green, some vegetables that are maybe orange, some that may be whitish. Depending on the color, it gives you different range of vitamins and minerals. So by eating the different colors, you tend to get the range of nutrients that we want people to be having. And also, vegetables give you antioxidants. Antioxidants are supposed to help keep the integrity of our cells. They are supposed to help us be able to fight inflammations, be able to fight infections. So it is very good for your immune system as well. And I'll come to the specific question of it in a minute. Usually, because some people do not like the taste of vegetables, it is good to use them in stews and soups so that you don't have to taste them if you don't like the bland taste. But also, it is important that you try the different ones. Sometimes you can put a little bit of peppers on it just to give you some flavor, or herbs on it, give you some flavor to be able to like different types of vegetables. And then the bit about your immunity and COVID. COVID has shown us clearly how important our immune system is. Some people have been able to withstand it, not only because of their immune system, but also because of some underlying conditions that they may have. But we know that by having good, strong immune system, you'll be able to fight the infection. And the key nutrients that have been identified as being important for the immune system are vitamin C, vitamin D, zinc, selenium, iron, and protein. And I'll tell you how to get these things. Vitamin C usually will come from things like your fruit. Your vegetables can give you some amount, but your fruit, citrus fruit, any type of fruit at all, will give you a lot of vitamin C. Vitamin D, usually we don't get it as much from our foods, but you can get it from the sun. And because in this country we don't get as much sun, it is important that many people have supplements of vitamin C. And then you can get your zinc and selenium from your whole grains, your beans, your pulses, and then iron usually from a little bit of meat, but also you can get it from other sources such as your green leafy vegetables. And of course, protein, you can get protein from your nuts, you can get protein from your poultry, eggs, and the other things. So how do you position yourself in such a way that you can build your immunity, not only for COVID, but also for other diseases as well? The best is to avoid processed foods, because most processed foods can negatively impact on your immune system. So if you eat a lot of things like pizzas, a lot of cakes, a lot of fried takeaways, then you are impacting negatively on your immune system. On the other hand, if you have more fruits and vegetables, it can help with your immune system. We know that it can even build your immune system from your gut, where your gut hormones act on it, your gut bacteria act on it, and it will help boost your immune system. I've also mentioned that things like your whole grains, beans, and pulses give you good fiber, and this is what the bacteria in your gut can act on to boost your immune system. It can also give you zinc. And then you want to add some nuts, seafood. It gives you the oily fish that I mentioned, which can also help in boosting your immune system. Unfortunately, drinking alcohol can dampen your immune system or weaken your immune system, especially if you do that regularly and you drink over the amounts that are recommended. In this country, the amount that is recommended is about 14 units a week, and that is roughly not more than about 6 pints a week. But diet alone, and I'm responding to a question that was sent to me by Joseph, and I think that was a very key question. Diet alone cannot cure COVID, and there's no cure for COVID in any way. It is how your body reacts to it, and by nature, it goes away if you're able to recover from it. So diet alone cannot cure COVID. Diet alone cannot prevent you from getting the infection. What you can do is to give yourself the best chance to be able to have a strong immune system to be able to fight the infection, because at the moment we depend on our own immune system to be able to fight the infection. So I wanted to get the message right. I'm not saying that when you eat right, then you become a Superman against COVID. What I'm saying is that if you eat right, you get your vegetables and minerals, you get your vegetables and fruits, you get your whole grains, beans, pulses. You are giving yourself the best chance to be able to fight the infection. But beyond that, there are other things that you can do to boost your immune system, such as drinking more water. It can help boost your immune system. Having good sleep can also help boost your immune system, and then exercising regularly. For those who smoke, quitting smoking can also help boost your immune system. But beyond the things that you can do to help your immune system, then we should also be following the guidelines that the government has brought. And also, if you get the opportunity to be vaccinated, then of course, go for the vaccine. But above all this, the best you want to do is that you want to think about healthy eating and have it as part of your plans. Part of your plans for me means that even before you go shopping, you have a written list. Because when you do that, then the supermarkets cannot trick you to buy things that you haven't planned to buy. Also, when you are going to shopping for food, ensure that you are not hungry, because when you go shopping when you're hungry, you're more likely to buy things that will satisfy that hunger. And it's important to involve the whole family in your in making changes to your diet. But because there is a lot of information out there, some of which are not helpful, it is important to get some professional support to understand the specific foods that may be good for you, which might not be good for other people. And on that note, I will ask if you want to ask any questions. And for those of you who want to get some one-to-one support, I'm happy to do that. We have some time for some questions. Thank you for listening, and I'll answer your questions now.
Douglas, probably for me, is probably, I think at the start, you kind of didn't give your presentations, like what you do, what you have done, your experience and that kind of stuff. Because I think some people have just joined us today. So you'd be good to kind of present yourself to them to kind of know.
I assume that they may have watched the video, so this was continuing. So my background is that I'm a dietitian. I worked in the NHS and I've been a dietitian for about 16 years now. I now write more or less guidelines for other dietitians to follow, and I see patients one-to-one as well. My main specialty is in diabetes. Any questions? You can unmute yourself and ask any questions so that I'll be able to help.
Probably a question for me is on the portion control. Maybe if you want to elaborate a little bit on that one, how?
Okay, so I had a slide about portion control from the previous one, and the idea is that usually this food is going to give you about 1,001 calories, but in a day for women you need maximum 1,005 to 1,000 or 1,005 to about 2,000, depending on your physical activity levels. So this is about more than half of what you need in a day, but somebody will sit down and finish it. The idea is that you use smaller plates, dish out your foods, and then add a few vegetables to fill out the plate. The other thing that will help is that you don't put your one food on top of the other. So for example, here, you don't put the fish on top of the rice. Otherwise, you don't have the best visual representation of the foods. But if you divide them so that each food has a section, then you will know how much of each food you are eating. Usually, your best bet is that certainly for your main meals, have some vegetables to go with it. So you dish out the vegetables first so that you don't have enough room for your meat or fish and the carbohydrates. And that's how people take small practical steps in reducing their portions. And the main reason why you want to reduce your portion is from the standpoint of trying to lose weight. Any other question?
Based on your experience as a dietitian, can I ask you if you have designed any daily menu which can help Africans, because you know the transitional period, people is we look into refugee who fled their country. They arrive here and they are unfamiliar with the diet. How can you advise them? What kind of food in your menu which can help their immune system to fight against the disease and to ensure that they keep safe during like COVID-19?
So that's a very good question. So there are a few general meal plans that have been put together by different organizations. But as you said, most of them are based on foods that are here, based on the British diet. But I'm not aware of ones that are specific to African or Congolese diet. I certainly have devised one based on a Ghanaian diet, but that was specifically requested by an organization that is looking after people from Ghana, and I devised that for them.
You may get a standard. I mean, because most black, irrespective of where they are coming from, there are features which are similar, and you can replace any previous diet using another, but then you may have the same intake of vitamin to help maintain your health. So it's like you can advise yourself, maybe from those who have access to this, they can have that one, and others, because given the fact that the cost also have an impact on people who are on low income, and most of the people, they leave their place early in the morning and they come only in the evening. And sometimes some people live on one meal a day. Maybe most of the time they are on tea and coffee, which is not good. So what can you advise such people to do?
Certainly, you mentioned that the cost has an impact on it. So usually what I advise people is to go for some basic food ingredients so that you do the cooking yourself. So things like bread, loaf of bread, will help you for breakfast. Even if it's cereals, you can have cereals in the morning. And then during the day, things like your rice will be a basic staple that many people can have. And then you can do your own stew or sauce, which should be based on any vegetable you like at all. Tomatoes, onions, you put them together. And then you go for fish for your protein, or eggs or poultry, chicken instead of meat. And then in the evenings, you can have things like your plantain, you can have things like your potatoes, sweet potatoes, particularly if you like them. And that you can have with some vegetables and also some fish if you like it. So it depends on the person's choices or the person's foods that they like, and then based on that, we can make a specific menu for them. Joseph, we have less than 1 minute to go before we get kicked out. So on this note, I thank you for coming. I've already recorded this and I'll send it to Joseph so that you can have a look at it. And if you have any questions, we can have another session to discuss that. Thank you and good evening, everyone.
Thank you very much.
Thank you.
Bye now.
Okay.
Daniel?
Oui.
Are you okay?
Yeah, I'm fine.